Greetings from Washington, D.C. This is Peter Thomas, General Counsel of the National Association for the Advancement of Orthotics and Prosthetics, NAAOP. Today I wanted to speak about the recent federal lawsuit brought by AOPA, the American Orthotic and Prosthetic Association, a sister organization to NAAOP and a member of the O&P Alliance. NAAOP is not a party to this new lawsuit that was just brought in the recent days, but NAAOP does support the lawsuit. And I wanted to try to explain why. First, we need to start at the beginning, back in August of 2011, when the Office of Inspector General for the Department of Health and Human Services issued a report labeled Questionable Billing for Lower Limb Prosthetics. Subsequent to that report, certain contractors of the Medicare program issued what they call a Dear Physician letter. It went to all physicians enrolled in the Medicare program. And the Dear Physician letter made it clear that the medical necessity of an orthotic or prosthetic claim is determined solely based on the physician's records alone, and in fact stated explicitly, not the records of the prosthetists. We find that to be an incorrect standard. We believe that the standard was issued without public notice and comment in violation of federal law, and that's in fact what AOPA alleges in the lawsuit. Second, BIPA 427, it's the section of the Benefits Improvement and Protection Act, which was passed in the year 2000, contains a mandate that CMS only pay qualified providers of custom orthotic and prosthetic care. And yet CMS has never implemented that statutory language. That's federal law that has never been implemented, even though the statute explicitly called for CMS to issue regulations 1 year after passage of that law. We believe CMS needs to issue regulations and implement that aspect of the law. We've been trying to get CMS to do that for many years, and they simply have not done so. And so one of the provisions in the lawsuit is to compel CMS to issue those regulations, and we support that as well. You know, the O&P physician documentation issue has led to numerous audits across the country, tremendous turmoil across the O&P field. O&P clinicians being devalued in terms of the documentation that they provide for the services they provide to Medicare beneficiaries. And in the end, it's caused tremendous business problems, cash flow problems for O&P providers, and problems in access to care for patients. This has reached a breaking point, and ultimately, I think we believe that AOPA had no choice but to sue the federal government, and we believe that NAAOP has little choice but to support the suit, and so we are doing so. We will continue to keep an open line of communication with CMS. NAOP is not a party to the suit, and so we can continue to communicate with CMS on this and many other issues. And we will continue to work with AOPA and our O&P Alliance partners on a whole wide variety of O&P public policy issues and priorities. Most among them being this issue of physician documentation, in trying to bring some relief to the O&P field and the O&P clinicians who practice within orthotics and prosthetics. Thank you so much for listening. We'll talk with you on the next webcast.